Welcome to the Deep Dive. Today we're tackling a pretty significant issue, one highlighted by the Centers for Disease Control and Prevention. We're looking at the connection between mental well-being, specifically diagnosed depression and anxiety, and smoking.
Yeah, and it's really important right at the start, I think, to clarify something. We're not just talking about feeling down sometimes or, a bit anxious. That happens to everyone. This deep dive is focused on diagnosed conditions, the kind the CDC data shows can really truly interfere with daily life. That's our focus.
Exactly. And for you listening in, wanting to get a good handle on this quickly, thoroughly well, we've waded through the CDC's information. We looked at, the signs, potential causes, how common this stuff is, that link with smoking, and crucially, what can actually be done. So the mission today is pretty straightforward. Make sense of this connection, smoking, and these mental health challenges, and pull out the key takeaways for you. Okay, so maybe let's start with depression itself. What is it, according to the CDC?
Right. Well, the CDC info makes it really clear depression isn't just like a temporary sad mood or a bad day. It's described as a persistent condition. It affects how you function day in, day out.
And the indicators they list, wow, they cover a lot of ground. Things like ongoing sadness or worry, losing interest in activities you normally enjoy, even feeling more irritable or frustrated, kind of restless all the time.
It can show up physically, too. The CDC points to sleep problems, could be insomnia, sleeping way too much, waking really early, also changes in appetite or weight, up or down, and even, aches and pains, headaches, stomach issues that just don't have a clear cause and don't go away.
And mentally, what about concentration and things like that?
Yeah, definitely cognitive effects, trouble concentrating, remembering things, even finding it hard to make decisions, plus that feeling of just being exhausted, real fatigue, even if you technically got enough sleep. And of course, the emotional weight, feelings of guilt or worthlessness, helplessness, and in serious cases, thoughts of suicide or self-harm. But, and this is vital, the CDC really stresses this isn't some kind of diagnostic checklist for yourself.
That's such a critical point, yeah. They strongly advise getting in touch with a doctor or a mental health professional if you recognize these things in yourself, especially if they're getting worse or really impacting your life. So, okay, what does the CDC say might cause depression? What leads to it?
Well, their research suggests there's no single trigger. It's usually a combination of things. Think genetics, biology, maybe environmental factors, psychological aspects. It's complex. But they do highlight some common contributing factors.
Like what?
Well, family history plays a role. If you have close blood relatives with depression, your risk might be higher. Also, experiencing trauma or really stressful events, things like abuse, losing someone important, major financial problems, that kind of thing.
That makes intuitive sense. And I think they also mentioned major life changes, even good ones.
Exactly. Even plan changes, like moving or starting a new job, can be triggers for some people. And physical health is definitely linked. Dealing with serious medical issues, cancer, stroke, chronic pain can contribute. Also, certain medications might have depression as a side effect. That's why it's always good to talk to your doctor about any concerns.
Right.
And finally, they mention alcohol or drug use as another potential factor.
It's quite something when you think about how many people this actually affects. What are the numbers like? How common is it based on CDC data?
The figures are pretty striking. The CDC reports that roughly 1 in 6 adults will experience depression at some point in their lifetime. And if you look at just 1 year, it's around 16 million American adults affected annually.
Wow. That really drives home that depression can touch anyone, any age, any background. It doesn't discriminate. Now, you mentioned earlier, the CDC notes depression often doesn't travel alone, right? It links with other things.
That's right. Anxiety disorders very frequently co-occur with depression. The CDC describes these as involving really intense, often uncontrollable feelings, anxiety, fear, worry, sometimes panic, feelings that disrupt daily life and tend to persist over time.
Okay, so this brings us right to the core of our deep dive today, the smoking connection. What does the CDC tell us about the link between smoking and these mental health conditions?
Well, the statistic here is, frankly, quite stark. According to the CDC, about 3 out of every 10 cigarettes smoked by adults here in the U.S. are smoked by people who have mental health conditions. That's a significantly higher rate than you see in the general population.
3 out of 10. Wow, that really highlights a major connection.
Yeah.
But the CDC is also clear that we don't fully understand why this link exists, correct?
Exactly. They acknowledge more research is definitely needed to get to the bottom of the underlying reasons for this strong association. But, and this is maybe the most critical point they make on this, smoking is not a treatment for depression or anxiety. They are very clear on that.
That is such a crucial message. So important. So, okay, if smoking isn't the answer, what does the CDC say about effective treatments for depression?
The good news, the CDC emphasizes, is that there are many helpful treatments available. The goal is usually to reduce the symptoms and shorten how long the depression lasts. They mainly talk about two categories: therapy and medication.
Let's unpack therapy first. Psychotherapy or counseling, right? What does that involve?
Yeah, psychotherapy counseling. The CDC explains it often focuses on what's happening now, your current thoughts, feelings, life issues. It's about learning coping skills, finding ways to handle challenges, maybe changing behaviors that aren't helpful, and finding solutions. Sometimes looking at the past helps understand the present, but the focus tends to be practical and current.
Right. And the goals can be varied. I think they gave examples.
They did. Things like just getting healthier overall, which might include quitting smoking or substance use directly relevant here, or overcoming specific fears, learning better stress management, understanding triggers for depression, improving relationships, lots of potential goals.
Sounds like being open and honest with the therapist is pretty key then.
Absolutely. The CDC points that out. Openness is important for progress. Then the other main approach is medication, specifically antidepressants.
Okay, antidepressants. How do they fit in, according to the CDC?
They explain these medications can help improve mood and just general coping ability by working on brain chemistry. They advise talking with a doctor to see if medication is the right path for you, and stress following the prescription exactly. There are a few important points the CDC makes about antidepressants.
Okay, like what?
First, patience is needed. It can sometimes take, up to 4 weeks to feel the full effect, though some feel better sooner. Also, side effects. They can happen, but often lessen over time. Definitely talk to your doctor about any side effects you experience.
Good to know. And stopping suddenly is a bad idea.
A very bad idea. The CDC warns against stopping abruptly without talking to your doctor. It can cause withdrawal-like symptoms or make the depression worse. They also mention potential risks during pregnancy, so that's a crucial conversation to have with the doctor if it applies. And finally, a reminder that medication isn't usually a magic bullet. It helps manage symptoms, but if your mood worsens or you have thoughts of self-harm, contact your doctor immediately. That's vital.
Thinking specifically about someone dealing with depression or anxiety who also smokes. What's the impact of quitting smoking on their mental health? Does the CDC address that?
Yes, they do. And this is really positive news. The CDC is clear. Quitting smoking will not interfere with mental health treatment. It won't make depression worse. In fact, they point to research showing that quitting smoking can actually improve mental health in the long term.
That's a really powerful counter-narrative, isn't it? It pushes back against the idea that maybe people with mental health issues shouldn't try to quit. Now, sometimes things become critical. If someone is having thoughts of suicide or self-harm, what's the advice from the CDC?
In those crisis situations, the CDC stresses getting immediate help is paramount. They provide the National Suicide Prevention Lifeline number. It's 988, available 24/7 for calls and texts. Super important resource. They also list other options. Call 911 or go to an ER. Contact your mental health provider or primary doctor. Reach out to trusted friends or family or even a faith leader. Get help immediately.
The CDC material also includes a personal story, right? Someone named Rebecca M.
Yes, Rebecca M's experience is quite powerful. She talks about struggling with depression and using smoking to cope, and how the more she smoked, the harder quitting seemed. But a turning point came when she started getting care for her depression. She realized she needed to focus on her overall health.
And her quote really brings it home. I quit smoking and I got care for my depression. It just highlights how addressing both things together can be so beneficial.
Exactly. It really shows how interconnected these things are. Making progress on one front can really boost the other.
So as we sort of wrap up this deep dive into the CDC's information, what's the core message, the main takeaway for our listener?
I think the key insight is this. Yes, there's a really significant overlap between smoking and conditions like depression and anxiety, a strong link. But, and this is crucial, smoking isn't a treatment, it doesn't help. And the evidence suggests that quitting smoking, especially alongside proper mental health care, is actually a path toward feeling better, both mentally and physically.
And just to reiterate, this is all based on information from the Centers for Disease Control and Prevention, a very reliable source. If any of this resonates with you, please seek professional medical advice. That's the clear recommendation. The CDC also offers free quitting resources, 1-800-QUIT-NOW, or you can text QUIT NOW to 333-888. There's the Quick Start app, too.
Yeah, and they list other great resources for more info and support. Mentalhealth.gov, NAMI, the National Alliance on Mental Illness, NIMH, National Institute of Mental Health, and the Anxiety and Depression Association of America. Lots of places to turn.
So as we finish up, here's a final thought for you to chew on. Given this strong connection the CDC highlights, this link between smoking and mental health, what could be the wider, maybe societal benefits if we invested more in really understanding the deep biological, the psychological gears turning behind this link? Something to think about. Thanks for joining us for this deep dive.